This is Dr. Hellen. It's been a long time, so I'm happy to be back. For those who haven't joined us before, I am a medical officer at Jacaranda Maternity. We have 3 branches. We have Kahawa, Ruaka, and Umoja, and we are a big team of doctors and nurses, including consultant obstetricians and other medical officers. So today we are going to do a quick Q&A on questions that we've been getting. So I'll start off with a question here. Someone asks, I am 20 weeks pregnant and my baby isn't kicking. What could be the problem? So baby movements usually start around 16 weeks to 20 weeks. So earlier for mothers who've been pregnant before, and a bit later for first-time mothers. So 18 to 20 weeks for first-time mothers, 16 to 18 weeks for mothers who've been pregnant before. So the first question would be, when's the last time you attended clinic? Have you had your 20-week scan? Because ideally we should have one at 20 weeks just to check whether the baby is developing normally. And if it's your first pregnancy, it may take time to feel the baby's movements. So it is very likely that there might not be a problem to begin with. Then second question, is it okay to be induced with a CS scar? So I would say this depends on the timeline. So if you're probably maybe have had a CS before and you have miscarriage in the early weeks of pregnancy, then the possibility of having a medical management through induction there is some leeway for that. But if you're well advanced in pregnancy and labor doesn't come spontaneously, then we usually do not induce with a CS scar here. Then the other question is, can I ask for a normal delivery when my baby is breech? So baby being breech means that instead of the head coming first, it's the buttocks that come first, sometimes the feet. So I'll speak for protocols. The risk with having a vaginal delivery with a baby who is in breech is that the head is the biggest part of the baby. So naturally when the head comes out, then the rest of the body follows suit. But if you're having a breech vaginal delivery with the buttocks or the feet coming first, then the biggest part comes last. And there's a possibility for the head to get stuck during delivery. So we do not advise for that. Then the other question is, what causes the placenta to detach, and can the baby survive when this happens? So there are several causes of the placenta detaching. The first one is when you're in labor, there's a possibility of having contractions that are too strong, like excessive stimulation of the womb, and that can cause the placenta to detach. Also, if you have high blood pressure, it can cause premature separation of the placenta, among other causes. But the other question is, can the baby survive when this happens? The answer is yes, if the intervention is done very fast. So usually within 15 to half an hour, you should have had a CS done. Sometimes it's possible whenever you're in the hospital facility and if you can get to the hospital in time. Other times then it might not be possible. It is an acute emergency. So if that is detected, then we aim for a CS delivery as soon as possible. Then the other question is, folic acid important during pregnancy, and is it okay to start during my second trimester? So folic acid is important because it is key in having a healthy nervous system for the baby, so the brain and the spinal cord. and those parts essentially form during the first trimester, so the first 13 weeks. And that is the time when folic acid is most important. And then as you move on to other trimesters, then you are more in need of iron. So it's important to start it as soon as possible. And if possible, if you're planning for pregnancy, then it is advisable to even start before you conceive so that you improve your reserves. And then the other thing is, can I have a baby who doesn't have SCA? I'm assuming this is sickle cell anemia, even though I have it. So the answer is yes, it's possible, because sickle cell anemia is what we call a recessive trait. So autosomal recessive. So what that means is that you can have, if you have a healthy partner who doesn't carry the genes for sickle cell, then your babies will not have the disease expressing. Instead, they'll have something called sickle cell trait, because they're getting one gene from a partner who does not have sickle cell and one gene from a partner who has sickle cell. So they carry the trait, and the trait usually does not manifest as, you know, as the disease. Then the other thing is birth asphyxia. Can the baby be helped? The answer is yes. So there are different levels of birth asphyxia, and asphyxia means when the baby doesn't get enough oxygen, and it's an event that can happen either during the pregnancy, during labor, or after delivery. And there's a mild form of asphyxia, there's moderate, and there is severe. That's how we categorize them. So severe birth asphyxia is ideally a condition that should be taken care of in a NICU. It's a neonatal ICU. For the mild and moderate forms of birth asphyxia, they can be sorted out in the nursery with good support, and babies do actually recover and have, you know, good milestones after. Then what causes the skin to turn black during pregnancy? So during pregnancy, you're going through hormonal changes. So there's an increase in estrogen, there's an increase in something called progesterone, and also now there's also excessive pigmentation, which is called melasma. So the skin turning black is as a result of hormonal changes during pregnancy, and it is normal, and most people experience it in the tummy and in the face. Then what causes multiple ectopic pregnancies? I've had two, one in the fallopian tube and one in the cervical canal. So there's some tubal factors, the fallopian tubal factors, that can cause someone to have an ectopic pregnancy. So your tubes have something called cilia. They're like to move along the tube, and for fertilization too, after fertilization has taken place. So if you have a slowed movement of that in the tubes, then you have likelihood of getting, you know, multiple ectopic pregnancies, amongst other factors. And so I think that's it. We are having more questions coming in. At how much weight should I be gaining during pregnancy? So I'll answer this. Targets of weight gain depend on your pre-pregnancy weight. So if you are overweight, then we recommend a pregnancy weight gain of about 5 kgs to 7.5 kgs. If you are underweight, it's about double that. and if you are normal weight, it's about 10 kgs. So it varies from person to person and depends on your weight at the beginning of the pregnancy or before the pregnancy. Then what complications can arise during the third pregnancy? I think this is a general question, and well, it's not necessarily that the more that in your third pregnancy you'll have a complication. However, the more pregnancies you have, the higher likelihood of things like excessive bleeding after delivery. If these are CS deliveries, then you have risk of injury to structures there because of the repeated nature of the surgeries, and you have the possibility of the placenta attaching itself to into the substance of the uterus, which can also lead to excessive bleeding. So yes, those are the possibilities. Then there's someone who's saying, I have a movable lump on my breast. Well, I think I will just explain because I'm not sure what the question is. So it's very good that you have noted that there's something on your breast. Now, it depends on what time of the cycle, first of all, you have noted it. Then the second thing is, are you breastfeeding or are you not? And what is your age? Those are most important. So movable small breast lumps are likely to be benign, but I would say it's important to get a medical examination so that you can ascertain whether it's something worrisome or not. For patients under 35, a breast ultrasound would do, and a proper breast examination by a healthcare professional. For patients who are above 35, we recommend something called a mammogram, which is a specialized imaging of the breast, so that we can detect, whether they are cancerous or non-cancerous. So different lumps in the breast may mean different things, and depends how the size. Are they painful? What's your age? How long have you noticed them for? So there are several factors to be considered, and it's important to seek your healthcare professional for this. Yeah. So then, okay, I forgot to take pregnant care for a month. What can I do to compensate? So I want to say, how far along are you in the pregnancy? So if you are, and what is your initial blood level? So the pregnant care is an important supplement because it contains iron supplements. It also has vitamin B complexes, but the most important is the iron supplementation, because your iron levels generally will drop during pregnancy. So if you've forgotten to take the pregnant care, how far are you along in pregnancy and what's your blood level? So if your blood level is low and you're closer to delivery, then we'll give you, different medication to try and boost it. Sometimes we give you even IVs, injectables. If you are a bit early on in the pregnancy, then you can just go back to, to your pregnant care, or we can give you another form of iron supplementation, because it takes generally about 2 to 3 months for the supplements to boost your blood level if it is low. Okay, when is it advisable to get pregnant after CS, and what is the risk if I get pregnant in a year? So advisable timeline is usually 1 year to 1.5 years, so that you can give your scar time to to heal and reinforce. So what is the risk if I get pregnant in a year? So usually it depends on the thickness of the scar. So if you have a very thin scar, then chances of there's always chance of rupture. There's always chance of going into preterm labor. You might have to be on bed rest for considerable part of the pregnancy. But I will say this: if you are already pregnant and maybe it's been a short time since your delivery, don't be afraid to come and and start your clinic right away, because we've had several moms who have been able to have a healthy pregnancy and go through the delivery safely. But it's probably best to seek medical advice. Then the other thing, my baby is 1 year old and I would like to have another one next month. So you probably want to try. I would ask you your mode of delivery. Was it a CS? Was it a vaginal delivery? And how well is your body adjusted post baby? So your iron levels, for example, your state of mind. Generally, your health is important to look at. But you can go ahead and try. I would encourage having a preconception clinic, just simply so that you can look at your mental, your health status before you get pregnant. And if there's something you can do to make it better and make your pregnancy easier, then all the better for you. What causes irregular heartbeats in pregnancy? Now, I would imagine this is for the baby. So if this is the case, then usually there might be variations in the blood flow of the baby. If there is something like if there is an infection in the mother, then it affects the heartbeat of the baby. If there is inadequate blood flow, if you have high blood pressure, so generally what affects the mother does affect the baby. So changes in blood flow will cause changes in the heartbeat of the baby. So can I opt for CS instead of induction, diagnosed earlier with gestational diabetes but regulated? So I think this is a discussion I would encourage to have with the gynecologist when you come for your clinics, so that we can do a plan of delivery for you. So as a patient, you have a right to choose your mode of delivery. However, it's important to be informed on what are the risks of each mode and what are the benefits. Generally, I would say vaginal births carry less risk, but this is from person to person basis. So I would encourage, if this is what you're leaning towards, have that discussion in the clinic with your gynae. It's something that we can finalize. We usually do counseling, especially if it is a fear of laboring and maybe it's your first baby and there are there's no medical indication for a CS. But we do have the discussions with our clients. We do counseling, and finally we arrive at a plan of delivery which makes both of us comfortable and happy. So please have the discussion with your gynae once you come to the clinic. So I haven't taken my pregnancy in 2 months. I think we've addressed this already. Can I go for a normal pregnancy after an ectopic pregnancy? The answer is yes, you can. So it's possible to get a normal pregnancy after an ectopic. Mostly with an ectopic pregnancy, it means that your pregnancy is not in the right place, not in the womb. So either in the tube or in the ovary. Sometimes it can be abdominal cavity. And most of the time, so there are two ways you can deal with it. There's medical management, but most of the time we find that it's ruptured and you have to do a surgery and probably take out a tube or an ovary. And even if that tube or ovary of one side is removed, you have one remaining healthy tube. So you can go ahead and have a normal pregnancy and even have a vaginal delivery. Actually, more than one normal pregnancy after an ectopic pregnancy. What I would say is to avoid the emergency pill, because it has been shown to to be associated with ectopic pregnancies. The other question is, how long does a CS wound take to heal? So it takes roughly 6 to 8 weeks. So because there are many layers that are gone through during a CS, 6 layers of the abdomen and your uterus, the skin heals the fastest. So within 2 to 3 weeks it will have healed, and then the other layers will. So roughly 6 to 8 weeks, and that's when you can resume generally your normal activities, driving. If you're someone who exercises or go to the gym, and then you can take on a bit of heavier, house duties. Then my lower stomach is still numb, and I'm 4 weeks post-op. I would say this is normal and there's nothing to worry about. Generally, most people who've been through CS feel a numbness in and around the incision site and the suturing site. So you get anesthesia, the medication to make sure that you're numb and pain-free during the CS. So there is a possibility that during the process of going, in and looking for the space, that some, the nerve roots could have been touched, but it is a normal thing to experience, and it takes time to get the feeling back. So I would say there's nothing to worry about. That, yeah. So preferable blood level. Say during pregnancy we want to maintain a blood level of 11 in the first and third trimester. In the second trimester, 10.5 is acceptable. Then when should I start sleeping on my side? Every time the baby moves, it hurts. Is this normal? So sleeping on your side is encouraged when you're pregnant, particularly when you start becoming a bit heavier. This will be around the second trimester and will start showing. So sleeping on the left side is encouraged, just so that you can displace the weight of your blood vessels that run through the back of your tummy, and it will generally feel a bit better. Every time the baby moves, it hurts. Is this normal? So your baby will stretch, probably kick, and your womb is anchored by ligaments that hold it in place, so that it just doesn't float around in the tummy. And these ligaments can be stretched, particularly when baby is moving, and it can cause some pain. It's called round ligament pain, and it is something that you can experience during pregnancy. It's considered to be normal, but if you're experiencing unbearable pain, please come and see us. Yeah, so how can I differentiate false labor from the real deal? Okay, so we'll start with talking about the real deal, the real labor. So signs of labor include your water breaking. So if your water has broken, that is the real deal. If you're having a bloody mucus discharge, that is the real deal. If you're having pain, not just on your lower tummy, so it's your lower tummy, it involves your waist and goes all the way to the back, and it increases in frequency and intensity. So it gets more intense it lasts a bit longer the next time it comes, and the intervals between the pain is starting to get shorter, then that is likely labor. So false labor, and then all these things that we've discussed, most of the time they'll come with changes in how open your cervix is. So when you come to hospital, we will examine you and we check how far you have dilated. So most of the time the real labor is accompanied by changes in your cervix. And then false labor will come, there's no increase in the frequency of the pain or the intensity. Most of the time the pain concentrates in your lower tummy. There's no involvement of the waist and the back, and it's not as regular, and you will not have the mucus bloody discharge, and your waters will not have broken. The other thing is types of back pain management. So I'm assuming this is home remedies, because if you are getting to a point where it's unbearable, then you need to consult a medical professional, because there's some medication which is safe in pregnancy and some that is not safe. So for one, the posture that you are in during the day affects very much how well you're going to take the back pain, and the frequency of it. So posture is important. If you can get a good seat, if you're someone who sits for long during work, then that helps. You can use warm compress on your back. Massages do help, and also painkillers, but for that you'll have to get a green light from your healthcare professional. Or there's also pregnancy pillows, which are helpful during, especially when you get heavy and the pregnancy has advanced. So is sex still safe? I think this is sex still safe when you're pregnant. So most of the time, yes, unless there is reason to not have sex. So if you have had like a threatened miscarriage, if you're on hormonal supplementation because of a threatened miscarriage, if you're just from a procedure like a stitch being put on your cervix because your cervix cannot hold the pregnancy together. So there are certain circumstances in which we will advise to not have sex during pregnancy, and it depends now from person to person. But if you don't have any of the other indications, then it is safe in pregnancy. So the other question, folic acid, how long should I start taking them as I plan on getting pregnant? It's a very good question. Because you are planning to get pregnant, I'd say to start as soon as you decide that you are going to try to get pregnant. Usually preconception care, we do, once you have decided to get pregnant, then we put you on the supplementation. Preferably 2 to 3 months is advised, but even if you have already started trying, then you can as well pick it up while you're on that train. When should I be worried if my periods haven't come back after delivery? So I would say maybe a bit more detail would be good to know, like how old is your baby, when did you last deliver, and are you having any other symptoms or challenges. For some people it takes up to 6 months, some people up to 9 months for the hormonal regulation to come back. So really I think it would depend on how far back your delivery was. So is it normal to still have spotting and bleeding 6 weeks post CS? So I would say yes. After delivery, particularly after a CS, you will have a flow. It's called lochia. So it's not quite the same as a period, but it's near similar, and that discharge goes as it's changing color. So about 6 to 8 weeks post CS, you should be having some form of discharge. And I think you're saying spotting, which means it's not a heavy flow per se. So and we're 6 weeks post CS, so this is okay. If it persists past the 8-week mark, then probably come and see us, and we need to know the extent to which. But spotting at that time is normal. And then I had my CS on the 29th of May. My periods have not yet come. It's 6 months. I think we've addressed that. That's okay. The other thing is I have pain between my thighs and I can't sit comfortably. I'm thinking this is someone who is expectant and probably very heavily advanced in pregnancy. So there is some pains you will have during pregnancy that are caused by, you know, the weight of the baby and the pressure on your pelvic bone, your hip bone. So if you might have pain in and around your groin, sometimes in and around your thigh, sometimes on your back, and on the bone in your back called the sacrum. So during pregnancy, especially in the late trimesters, this is a normal thing to experience. If the pain again is unbearable, then you can come and see us so that we can advise how to proceed with this. Some people might need bed rest. For some people, if you're already at term, you might choose to deliver. So please seek professional help. I had my period on 6th on the same month, and I had them on 19th. What could be the issue? So yeah, I think the way to approach this would be, is this a regular occurrence? Is it a first time occurrence? Was there any contraceptive used in between, especially the emergency pill? It can sometimes mess with your period. What are your stress levels? Recent travels, have you had an ultrasound done? So if it's a one-time occurrence, then I would observe to see if it repeats itself. If it is something a bit more regular, then you do need to seek some professional help so that we see if it is a medical condition or it is some form of hormonal imbalance. Yes. Then take the final round of questions. What is a short cervix? So a short cervix is anything less than 2.5 centimeters in length. Also, there are people who experience progressive shortening of the cervix when they are pregnant. So you might start off with a cervix which is normal length, and then it progressively shortens. Then that also qualifies you for a stitch. I'm assuming the person who is asking has been told this before, and if you've been told you have a short cervix, or if you had a near painless miscarriage, especially in the second trimester, then you probably do have a cervix that is short or incompetent, and you do need a stitch around 13 or 14 weeks of pregnancy. I think we've touched on this. Why do I need a McDonald's stitch? So if you've had if you have cervical incompetence, which means that your cervix is either short, which is what we've talked about, or is not able to hold the pregnancies up to term. So if you've had a history of miscarriage, usually it's more than one, probably in the second trimester, and with reducing, gestation, then you do need a stitch. It holds the pregnancy together up until when the baby is mature enough to be delivered. We put it around 14 weeks, and we take it out at 37 weeks. Then my period started 3 months post-delivery. Is it normal? Yes, it is normal. People have different, rates at which the hormones balance after delivery. So this is a normal thing, yes. And it also means that you can get pregnant even when you're breastfeeding. So it's important to have contraception, especially when you're coming for your 6 weeks clinic, because you're still quite fertile even after delivery. So, does PCOS stop after delivery? Well, no scientific information as to that. So, very likely not. Yeah, I think we are done. So it's been great. I think we saw each other last a while back. So let's engage on this platform more. Maybe you can give your ideas on what you want to be discussed next time. If you want to do a topic instead of a question and answer. And we always have our client engagement team ready to to answer your questions, and you're very welcome to interact with us and visit us anytime. Yeah. I have pain just above CS wound. The wound is healed though. So I would say first question would be, how long after your CS delivery are you experiencing this pain? Sometimes it could be neuropathic pain, in which case it's something that can be sorted with some pain meds. If you have sometimes you have a collection of fluid around the CS wound, you might have those, that pain even if the skin looks like it's healed. So the question would be, how long after CS have you experienced this pain? And because if it's within the 6 weeks mark, there could be a collection of fluid that needs to be drained. Or it could be, if it is a long time that has passed, it could be neuropathic pain.